And
And Claudette and Britt, this is Scott. I'm just going to be muted, and I'll chime in if I have to. But I'm on the road, and I'll be on the road the whole time here. So, but I'm here.
Okay, Scott, I'm planning on.
Sorry.
Is that Robin?
Sorry, go ahead, Claudette. Yes, this is Robin, and Kate is going to be on the call as well.
Hey, I'm here.
Hi, Robin. Good morning.
Good morning.
I was just sharing with Claudette and Britt, and you may have heard that I'm just going to give them a few moments once everyone's on the line to just kind of share any information they think might be important about the locations, maybe about their employees with the enrollers. And then Olina is going to start walking through the benefits and then the schedule. And what she'll do is bullet point the highlights of each of the benefits and take a moment after those core benefits, especially the medical, the dental, and the vision, to give an opportunity if you have more information to share that you think is pertinent for the enrollers.
Okay, great. I think we can get started then. Everybody should be on the line.
Wonderful. So Claudette and Britt, we have quite the staff on here. We have Erin, we have Debbie, Galen, Daniel, and Irby, and I think I caught everybody. So I'm going to tell you, you're in great hands with this group here. Plus, I believe, Olina, you'll be on site as well?
Yes, I'm one of the counselors. Mm-hmm.
Excellent. So I'm going to pass it over to you ladies to maybe share a few things with the staff. Claudette or Britt?
Okay, what are you needing to know?
Because we figured we'd give you the opportunity to share a little bit about Louisiana CAT, to maybe share a little bit about your employees, some things that might, be good for the enrollers to know.
And that could also include, changes to plans from versus last year, enrollment method versus last time, and so on.
I think as far as my employees go, you're going to have some people that's going to understand everything that they're going to go in knowing what they want. Other people, you're probably going to have to take a little more time with them.
Yeah, and I think it's good also for enrollers to for people who don't know exactly what they want, to kind of explain the difference between the embedded and the non-embedded high deductible and how it works for a family and So you guys, I have some handouts that I've done. If you guys want, I can send them to you. It might help when you're doing the one-on-one meetings.
Right, because their first question is going to be what changed from last year. So they're going to want to know what I was paying and what am I going to be paying now.
Yeah, so you guys, so the enrollers might want to, just explain how the contributions are increasing on the PPO and the tobacco, and then they're decreasing for the high deductible.
Okay. And outside of that, there were, and please forgive me, I'm just, confirming, there's no changes as far as the medical carrier or plan designs?
No.
Correct.
Great.
All right, very good. So I think I can kind of start diving into this material. Thank you so much, ladies, and good morning to everybody. This is Olina. So yeah, I understand that we have a new dental and vision coverage, right? The two plans are new, and the carriers MetLife, and then obviously all of the voluntary coverages are new. So and we definitely, when we sit down with the employees, our role is to educate. So we'll definitely go by individual basis. The team that you guys have it's all just veterans. So we definitely, our priority is to educate, and we kind of gauge it to the needs of who we're sitting with, whether they have questions or they know exactly what they want and they understand the benefits. So definitely in the good hands there. All right. So
Olina, can
Sure,
Can
yes.
I just point out a couple things that we want to also tell employees? So there's a new voluntary add-on mail order option that they're going to have for their prescription drugs.
Yeah, I saw that, yes.
You saw that. Okay, so we want to point that out, that so that they know. I mean, it's all mail order. It's completely voluntary, but there's a list of drugs. It's called RX Manage. There's a list of drugs in their benefit guide, so they might want to look at that. Another thing is, like you said, we're changing carriers on the dental and vision, but for the dental, their plan year maximum is increasing to $1,800 per person versus the old $1,500.
Oh, great.
And
that's good.
And then implants are included, which is a new benefit, and their deductible that they're going to pay for the preventive services, it goes towards their plan year maximum, which it didn't used to, which is why we negotiated the increase to $1,800 per person. So you might want to point that out.
Very good, excellent.
And then and you're welcome. And then one more thing, a lot of times employees don't remember that their vision is on a rolling 12-month basis. It's not a plan year basis. So their benefits, that we just like to remind them, their benefits are administered on a rolling 12-month basis for the vision.
So it's the calendar year, right? It starts on January 1st?
Well, no, not necessarily. It's going to be, so if they go and get their contacts or glasses in, let's say, March.
Oh, I see, yes.
They can't, so it's a rolling 12 months. It's not January through December or September through August.
I see, very good. Okay. All right, great. Thank you. Thank you very much. And if something else pops up, that you remember that you want us to know, just go ahead and, jump in. There's no problem. I am recording this session, so all of the counselors will receive a recording. I can review it because we might be quite a bit at once. So just a quick look at the schedule. This all has been sent out to everyone already, and it is quite busy schedule. So, but everybody's familiar with it. Our counselors have seen it and are okay with it. If we can ask you, please, yes, if you could please contact on the second tab, there's addresses and we have phone numbers there. So if I can ask our team to please call your location ahead of time, a day before ideally, and just remind that location that you're going to be there at what time. That is actually really important because the schedule is changing so much. We're not staying at one location for, the whole week. So definitely do that. We would appreciate that. It would help us to make sure that everything goes smoothly. All right.
And then I also want to I'd like to add something regarding the schedule. And I don't know if it's the version you're showing there, Alina, but in the top right, there were some locations identified. If it's not this one, I'll send it to you guys. But there's locations that have employees that we'll have to probably stay a little bit longer for, come in a little bit earlier or stay later, because those employees are they're not necessarily at the location. So we're going to just have to accommodate for that. And for the most part, it's not an issue, but it's just a few locations there. And we'll talk about this later today. There's just a few locations where we have to make some accommodations. That's all.
Excellent. Yeah, I was showing the schedule that has the green and yellow technicians column at the end. Yeah. So we see that. Very good. Thank you. All right. So
technicians are going to be harder to get. That's all my point is. So whatever accommodations we need to do, just know that those people are out there. All right.
Definitely.
Thank you.
It's Irby. I have a question. Have we verified Wi-Fi at all the locations?
I think all of my locations have Wi-Fi except maybe Lake Charles. I have to check that.
Okay.
Lake Charles.
Yeah, and Irby, who's the enroller going to Lake Charles?
We have Galen, 20th and 21st. So Galen.
Okay. And I believe Galen confirmed that he has Wi-Fi or a hotspot on his phone.
Excellent. All right.
If you need to find out, Claudette, that they have Wi-Fi, if you'll just let us know, confirm either way, and we can just so we know. It's a little quicker with Wi-Fi.
Yeah, because the reason I'm asking is I know some of these locations were there at 6 in the morning, and a lot of times we're waiting on somebody with the password to get on the system. So that's why I'm asking. So that way, I like to be there half an hour early, be set up and ready to roll. And that's why I'm asking about the Wi-Fi and the password.
Okay.
Claudette, is it password protected or is it an open network?
There is a password in each store. I think it's different.
Okay, so that's a good point, Ruby.
I think it's. I'll find out.
Okay.
All right, very good. So I have opened up the employee benefits guide, and just starting from the top, it is 109 pages. So we obviously don't have the time and space to go through everything in detail, but counselors, if you would please review everything, make sure you're familiar with all those little extra benefits that the employees have available to them. That would be great. In case they ask about it, you guys know what's available. So the eligibility for employees is full-time employees. They have to work 30 hours. Children are covered up to 26 years of age. And new hires, I don't know if we'll have very many instances of that, but they're eligible first of the month following their 30-day. If there's any qualifying event, they need to let HR know within 30 days of that change. And we're looking at 3 medical plans available, 3 options. Classic PPO, we have NHSA, and we have EHSA, option 1 and 2. Basically, the PPO is going to be your kind of the most expensive one and the best coverage as far as paying out of pocket, lowest deductible. And the other 2 options have the HSA option, and they're basically high deductible plans. So they have to cover their deductible first before they have any co-insurance. Actually, they're covered 100% after that. All right, so once they cover on the high deductible plans, once they meet the deductible, they're covered 100%. On the PPO, once they hit the deductible, they are covered at 80%. So employee is responsible for 20% of the remainder of the cost. The deductible on PPO is $2,000 for an individual, $4,000 for family, and HSA is $3,000 individual, $5,000 family, and then the EHSA is $4,000 for individual, $6,000 for family.
I don't think that's right. That's not right. It's 3, right, Robin, and 4 and 8.
4 and 8. Okay, 1 second. Let me see. I might have I opened the maybe older copy. Let's see.
Oh, I'm looking at it wrong. I'm looking at the wrong squares. Forgive me. Up and down. Okay, it's up and down, not across. I was looking across, and I think you were saying across. It's up and down on the column.
Oh, I did out of network. My bad. Yes.
My bad too. So.
Thank you for that. My bad. I'm a linear person, I guess. But yes, it's 2 and 4, 3 and 6, and 4 and 8. Thank you so much for that. What's important here is that NHSA is a team deductible, which means is that it's the aggregate, which means that if family is covered, that an individual, only one person goes to the doctor, one person has problems, they're sick, they keep going to the doctor or hospital, they themselves have to meet that whole entire family deductible before the coverage, they're covered 100%. Okay, the other two plans are embedded, which means that the individual deductible is going to be the most that one person is going to pay, even though the family is covered. Is that correct, ladies?
Yeah.
So 2,000 on the PPO, 4,000 on the EHSA. Just keep that in mind.
On the EHSA, one person covers the 4,000, and then the rest of the family members can cover the other 4,000.
That's correct. Yes. Amongst any of the family members, once they hit 8,000 as a family, they're covered at 100%.
Correct.
Very good. Yes. And then PPO is the only one that has copays. So when they go to the doctor, they have a $25 copay for primary care physician and specialist visit. And there's also a copay in emergency room of $100. And then the rest of it is all deductible and coinsurance. On the prescriptions, on the PPO, there are copays, three tiers based on what type of drug it is, $10, $30, $50. And the other two plans, they have to hit the deductible before the prescriptions are covered. In the guide, there are at least two different programs for prescriptions, kind of cost management, so they can shop around, and there's different places where they can check prices and to make the best decision for their pocketbook. Oops, come on. So prescription drug coverage is just explaining these pages here. They do need to look out for new ID cards for their medical and prescription.
I don't know. Robin. Is Robin not on the line anymore?
No, she is. She's asking about that, actually.
No, I'm here. I don't think they're needing new ID cards because the medical.
Yeah, is this just for new people? For new?
Yeah, I think new enrollees would get new ID cards.
Okay. All right.
But existing employees can use the ID card they currently have. They're not going to.
Okay, that was my question. Thank you.
Perfect. Okay. To find a provider, obviously go online. There's some tips on how to save on your medical cost. There's a web-based page where the doctors can come in and kind of check the prices when they're recommending procedures and just kind of, again, shop around for best price. It's called the Healthcare Blue Book.
Olena, it's Irving. I have a question before we get too far down the line. On the existing cards, if they change plans, are they then issued a new card with a new card number? Or does the number stay the same?
If employees are changing medical plans, if they're switching plans, they're going to get a new ID card, yes.
Okay, great. Thank you.
Great. Yes, the system is going to collect the tobacco question, and there's a tobacco cessation assistance programs. So just kind of read over this. Our team, there's a Louisiana Smoking Cessation Trust for people that are Louisiana residents that can, if they were smoking before 1988. So there's a little bit of a rule on that one, but it is available to them. And then they have a smoking cessation assistance through their regular medical coverage. There's a diabetes wellness management program where they can get their supplies for free. They have a telemedicine access 24/7, also for their dependents. And then HSA contributions on those two HSA high deductible plans. If they take option 1, Louisiana Machinery is matching dollar for dollar for up to $42 per month. And on the EHA option, it's a little bit higher. It's up to $62.50 per month, dollar to dollar match. With the HSA, just review. There's good information here. Review what it is. You know, all the medical expenses can be used here to pay with this HSA monies. They were pre-taxed, and there is for new people that enter into HSA for the first time, they do have to take the extra step after they meet with us and sign up in the system. They have to go into the hsa.umb.com. I believe there's
Yeah, we don't allow them to do that. What I need your enrollers to do is take their name and get it to me or Britt, and then we'll take care of getting their account open. We have removed that from the booklet.
Oh, I see. All right, so just
we want to be able to. We want to be able to keep track of who is opening who wants to open any HSA account. So we just need a list to go to Claudette and Britt.
Okay.
After.
Yeah. So the enrollers don't need to track that. We'll just pull that from the system as soon as we're done.
Or you can pull new enrollees.
Yeah.
Okay. All right.
Oh, perfect. Very good. So scratch that one.
How often can you pull that? Because we don't want to wait too long. We want, it may take us a while. There's a few.
We can do it as often as you want. You want to do it at the end of the first week and the end of the second week?
Yeah, let's do it like that, please.
Okay.
And I also found out that Lake Charles does not have Wi-Fi.
Okay.
Okay. All right, so I am jumping over to dental coverage with MetLife. So very straightforward plan. There's a deductible $50 for individual, $150 for family, $1,800 maximum benefit per year per person, increased from $1,500 from last year. The preventive and diagnostic services are covered at 100%. There's no waiting period for that. Basic services like filling and endodontics, they're covered at 80% after deductible. And major services covered at 50%, orthodontia 50% for children only up to 19 years of age, and there's a $1,000 limit per child. There is an out-of-network coverage, but it is on a reimbursement basis, so they're going to definitely pay more there. Voluntary vision plan with MetLife as well. Also very straightforward plan. We have this is the one that deductible reset or renew every January 1st, right? So it's it says it's offered 12 months basis.
Yeah, it's not every January though, Alina. It's a rolling 12-month basis.
Okay.
So it's not necessarily January through December. It's just whenever they decide to use their benefits. So let's say it's in July, the rolling 12 months, they won't be able to use it again until 12 months later.
If they use it up.
But this is a new plan. Everybody can go, right? Everybody can go now, and it wouldn't matter when they went last time, right, Robin?
So, yeah, that's correct, since we're switching carriers.
Right.
Hey, Robin, this is Erin. So just as an example, so just you tell an employee, look, your benefits go effective 9/1, but if you wait till November, then you can't have another exam until next November. So it's just the anniversary date from their initial visit.
Correct.
Right. So you can, I mean, if employees want to, if they haven't used their benefits under the current vision plan, they want to use it before September 1st, they should, because then they're going to start over. Since we're switching carriers, they're going to start over September 1st. So even if it's been less than 12 months, they can use their benefits again come September 1st because we're switching carriers. If we were staying with the same carrier, then that wouldn't apply.
Mm-hmm.
Does that make sense?
Yes. Very good. So they have $10 copay on eye exam. They have lenses for $10 copay. Contact lenses, $10 copay. All three of these are once every 12 months. And then the frames are every other year, so 24 months between frames, and they can get them for $10 copay. We have a basic life insurance with Aetna that includes AD&D. It's 100% employer paid, $50,000 amount, benefit amount. They can purchase up additional term life insurance with Aetna. Any increases or late entrants require EOI, and we'll again make sure that we either have copies, or I don't know, Christina, if we send it out already, or if locations are...
What I plan on doing, Scott sent me some brochures or booklets that he wanted each branch to have. So I'm going to have the booklets sent to the branch. I'm also in that packet. I'm going to have copies of the EOIs in case we need to use that. And then I'm hoping to also in that packet have maybe the password for the Wi-Fi. Great,
that would be great. Okay, but yeah, basically, unless they're new hire, they're gonna have to do EOI, and the system is gonna let you know if it turns red. That means we need EOI, and we'll look at it together. So that's pretty good reminder system there. Spouses and children are not eligible for accidental death and dismemberment part of it, so the employee is the only one that gets the AD&D piece of that, and here are the rates. Short-term disability and long-term disability, I understand they're kind of sold as a package, so employees can have just one. If they want one, they have to get both of them. Is that correct?
Correct.
Yes, very good. So for short-term disability, we're looking at 60% benefit amount. So 60% of their income is going to be paid out if they cannot work due to illness or accident. And the benefit goes for 13 weeks. There's a elimination of 8 days for salaried employees and 15 days for hourly. And it's also EOI. So we also need for late entry, we're going to need evidence of insurability as well. All right. For the long-term disability, we're looking at also 60% benefit amount for salaried employees and 50 for hourly. We have 90-day elimination period. There is a pre-X of 3 and 12, 3 months before, 12 months after effective date. And it's pretty much self-explanatory after that. Met Law is the new legal plan that's available to the employees, access to 15,000 attorneys, network of 50,000 attorneys, and it's for $21 a month. It covers everybody in the household, so all the dependents. And this is the list of available services that are included in the plan. Very valuable benefit. And there's instructions on how to submit a claim or get your appointments scheduled. And then the rest of the guide has a lot of information on a prescription program. So like I was saying, I would definitely familiarize myself. There's I saw like an international prescription program where you can get the same drug for much cheaper cost. So especially for
Alina, I think the best way to communicate it to employees, because when you say international, so they are coming from overseas, but it's the exact same drug. It's just the way it's dispensed. So I think maybe the best way to say it is we don't really even need to. I mean, there's enough information in there for them to read about how it works. But I think really we just need to let them know that it's a mail order, voluntary option. They can get the drugs at about a third of the price of what they would otherwise, and this is just an option for them. So I don't think we need to go too much into the fact that it's international.
Yeah, I just got excited because I'm international. No, I'm just kidding.
Oh yeah, no. I mean it's not bad. Like it's not a big deal if we do, but sometimes people it just kind of confuses them a little bit.
Yes, and they get kind of just
Elise,
question.
You didn't go over GAP, critical illness, hospital indemnity.
Yes, I'm going to go into a different place to review those. I just skipped over it in the guide. Yes.
Okay. And universal life.
Yes, I'm going to go over that. I'm just going all the way down through the guide. So we've covered that all. Yes, we're good there. I wanted to go to, I'm using the training site that we put together for the counselors. So we looked at the guide, and now I'm going to go to Transamerica Cancer Policy. We're going to look at Transamerica Universal Life and the CHUB, Critical Illness, Hospital Indemnity. So
I want to make sure that the enrollers know that if the employee takes medical, they automatically get $50,000 worth of life that Louisiana Machinery pays for.
50,000 of what? I'm sorry?
Basic life. If they enroll in medical, they automatically get 50,000 basic life.
I see. Okay, good point. I saw that in there. Yes, so they have to enroll in medical in order to get the basic life.
That is correct.
Great point. Thank you. Thank you for
the voluntary life.
And
Alina,
Alina,
go ahead, Scott.
Go ahead, Robin.
I was just saying, I just sent Scott, Alina, you and Scott and Christina a couple things. I just emailed you a few minutes ago a couple things that might be helpful.
Okay, thanks. Alina, I just want to point out that the GAP, the American Fidelity GAP, is in the benefits guide only, not in the other.
Thank you. Yes.
Yeah.
Let me. Let's see. Get to that faster. I think it's page 45. Yes. So, and this is an existing product, correct? It's already in place?
Yes.
All right. So yes, gap insurance is basically covering exactly what it's called. It's a gap between that deductible and when the insurance actually starts paying. So it helps the employees to cover the inpatient cost. Their choices of $500,000 or $2,000. So basically for their inpatient, this plan would pay that amount, whichever plan they select. With the amount of benefit for inpatient, it's going to pay towards their deductible. And outpatient benefit is $200, and that's mostly for emergency room or surgery in an outpatient facility. And then there's a physician outpatient treatment benefit of $25 per visit. They'll do it 5 times per family per calendar year. So that's the GAP policy with American Fidelity. Whoops, sorry. So I was looking at the cancer plan here with Transamerica. Also, our agents are really familiar with these plans, so I'm just going to do a really high level, but this is a new plan, and it pays employees if they are diagnosed with cancer and going through any of the treatments or procedures that are listed in the policy, and there's a dollar amount that's assigned to it. So hospital confinement, there's 2 choices, 2 levels of plan 1 or 2. So hospital confinement, they get either $100 a day or $200 a day, and it goes beyond 91 days. So it's basically as long as they're there. Extended benefit is included. If they see a physician, they get some money. Prescriptions, ambulance, if ambulance is taking them because of cancer, hospice, surgery benefit, inpatient, outpatient, surgeries, skin cancer, and then radiation and chemo is the big benefit. $5,000 on plan 1 and $10,000 on plan 2. And I believe that's it. There's a wellness benefit of $100. So if the employee goes through any of these tests as a preventive, mammogram, blood work, chest x-ray, they can actually submit a claim and receive $100, and it's per covered person per year. MRI, $100, lodging, physical therapy, 1 treatment a day, so it's really good. Initial diagnosis on the second plan, they'll get $1,000. The first plan doesn't have a dollar amount in there. So monthly premiums and just additional information, limitations, exclusions. We have Transamerica Universal Life plan. I think are these just rates? Let's see. Yeah, that's just rate tables.
Yeah, it's a rate sheet, but at the bottom of it, it has some description of the rider.
Oh, okay. That's all we have. All right. So yes, we have. I think the most important one is the long-term care rider. So they can use this policy to pay towards assisted living, nursing home. You guys are all familiar with this, but 4% of the death benefit can be used for 25 months. There's the accelerated death benefit, so they can cash out part of the policy if they are terminally ill. And that's about it. Very self-explanatory. Universal Life.
Elena, is this is Erin. Sorry, the UL though will require underwriting, correct?
Scott, Christina.
Or is it going to be guaranteed?
Is it new or was it there before? I'm not sure.
No, it's not.
I believe it was there before.
It's not a new plan. It's a current existing plan. So yes, if they're a late entrant, they will require underwriting.
And that will be, the questions will be built in the system, or do we have an EOI?
No, they're in the system.
Okay, I thought so. Okay.
System will tell you. Okay. So there's that surrender form. So again, if anybody wants to cancel their UL, they need to submit this surrender form in order to get any cash value that built up over time.
Yeah, so if they don't fill out the form and give it to Trans, then Trans is going to spend down their cash value until that's exhausted and then cancel the policy. So they have to notify them that they want to cancel it so they can get their cash value out before that happens.
Yeah, otherwise they keep it going for as long as that cash value is there. Okay. All right, I'm opening up Chubb offerings. So we have accident, critical illness, and hospital indemnity. We are very familiar with this. So accident plan with Chubb, straightforward. It's a 24/7 coverage, guaranteed, renewable, fully portable. You can cover dependents as well. There's a $50 wellness benefit. So if any of the covered members do any of these tests that are listed in the policy, they can get $50 back every year. We have the specific schedule of benefits. For the sake of time, you guys, I don't have time to go through everything. But again, we're very familiar with these plans, so you guys can just let me know if you have any questions, but it's pretty straightforward.
Is the accident plan on and off the job, or is it off the job only?
24/7, yep. Critical illness is going to pay them a lump sum benefit if they're diagnosed with these critical conditions listed in the policy. The big ones are heart attack, stroke, cancer, brain tumor, end-stage renal, organ failure. Again, some of them, couple conditions here are 25% of the face amount. Skin cancer benefit is $250. The maximum the policy is going to pay is 3 times the critical illness benefit, so that full 100% could be paid out 3 times. The pre-existing condition is waived, so it's guaranteed issue. There's a recurrence benefit, so if they have another heart attack, another stroke, it would pay 50% of their benefit amount second time. I believe they have to be 6 months apart for that to be a separate occurrence. Access to doctors for advice, second opinion. Again, wellness benefit here is $50 for each covered person, one a year. There's an occupational package. If they get a HIV or hepatitis B, C, or D, they can get 100% of the critical illness benefit on that as well. And let me see. Yeah, it's pretty good. And we have the hospital. Sorry, I'm scrolling a lot. It's hard on the eyes. So it's called High Deductible Buffer Plan. That again is going to help them with that hospital big expense. You know, normally deductible comes into play, so it's they pay a lot out of pocket if they're hospitalized. So this plan helps them in those instances. So admission to the hospital, they get $1,000 for first day, regardless of how much it actually cost them. They're getting $1,000 if they were hospitalized for any reason. So accident, illness, surgery, and then hospital confinement, they're getting $100 a day up to 30 days. And for intensive care unit, there's additional $50 per day for up to 15 days. So that's the hospitalization benefit. And the premiums, they're all going to be calculated for semi-monthly deductions in the system. And you have exclusions listed here, and that's it for Chubb. All right, and then we have...
Alina, I think we missed one. The Met Law is a new plan?
Yes. That was
Did you cover that? Maybe I missed it.
I just mentioned it, but I'm opening up the brochure right now, and
Okay.
Yeah, I talked about it in the guide, but all the details of the plan are here in the brochure.
Okay, that's great. One thing to note on that, though, it is a new program. It is with MetLife, and there's a participation requirement on that of 10%. So we've got to work on getting that. Okay. We'll keep track of it. Keep you guys informed when we hit the number.
All right, so we have about 15 minutes to look at the system. Again, all of our counselors are very familiar with the platform, so they're veterans. So I'm just going to run through a test employee here to see how everything is going to come together in the system. And there's still a little bit they're finishing up on the Chubb side. So I have license in Louisiana, but they haven't finished it up yet. Personal information.
I have a question. So if someone right there has an email address, you're going to show them the screen and ask them if their mailing address is correct, and if they want to keep the same email address, or if they want to add another one.
Yeah, definitely.
Their personal email address on there. Most of the time it's their work one, but a lot of the technicians don't get the work email, so they like to change it to their personal email.
Yes, so we would ask that when we're meeting with each employee. Would you like to receive, they do receive automatic confirmations after the enrollment, so yeah, definitely. And I always check, is this your address still, is the address correct, and then phone, email. Yep. And then are we adding any dependents, spouse, children? Really easy way to do it. You just click on plus sign and add the person in, or delete them from here.
Can we do one additional thing?
Sure.
If the employee's address is incorrect and the enroller's corrected, please tell my employees that they have to go into Paylocity and correct their address, because what's going to happen is you're going to fix it in the system, and then when Paylocity is going to feed over their address, it's going to correct it to the wrong address.
Okay.
So tell them if they change their address, say please go into Paylocity and change your address. And if you don't know how to do that, call HR and they'll help you.
No problem. We're noting that. All right, next screen is going to be our tobacco question. So in the last 12 months, have you or your spouse used tobacco products? And then next screen is going to tell them that they may be tested. Right, is, let's see. Yeah, future testing. So they have to say yes to that. Anybody around you uses tobacco products? Hopefully not. And here are the medical options. So
okay, I think we're missing something. We have a policy that if the spouse is employed and his employer offers medical coverage, we will not cover the spouse for medical.
yes, I think that's a question that comes up next. So if I choose employee and spouse, if I want to cover spousal medical, let's see what happens here. I saw those questions in there. Yeah, it's the next screen. So
okay, I'm seeing it before. Okay, all right.
Yes, ma'am. So is your spouse employed somewhere else besides Louisiana Machinery? Yes. And then second question, is your spouse eligible to enroll in his or her company's group medical? So this is where we would collect that information. So if they are eligible, they're not going to be able to get medical for their spouse. All right. HSA is the next screen. So we just choose how much they want to have, either total number at the end of the year, or they can give us per pay, whatever they like to do. If they'll say, I want to do $50 per pay, we just calculate and it tells us what it's at the end of the year. And then next screen is gonna remind them that they are getting a match depending on which plan they have and how much Louisiana Machinery is matching dollar for dollar. Good. Okay, we have, this is a reminder for them to fill out that if they're first time into HSA, the system actually tell us, please say this to the employee. To fill out the HSA form, complete it, and give it to Claudette. Because I'm using a test employee, the system thinks it's new, so that's why it's doing it.
It's not Optum Bank anymore. It's UMB.
All right. Can you, Christina, are you on the line still?
Yes, I am. What was that one more time?
Did you get that? Oh, wait.
HSA Bank, our bank for the HSA account, they had Option Bank still right there in a form. We actually use UMB.
Oh, so we need to change the
UMB. Okay. Okay. I will do that. Thank you.
Thank you. All right, basic life insurance. So because they selected medical, they're going to get employer paid basic life insurance. We choose a beneficiary. They can sign up for cancer plan. There are two options. Remember option 1 and 2. $5.94 per pay. We choose a beneficiary. Are you actively at work? Yes. Are you on Medicaid? No, hopefully. Do you have AIDS? Do you have any, have you been treated for cancer in the 10 years back, 12 months back? Have you received any medical treatment for cancer, or has not been yet completed? So do you have anything scheduled? Hopefully not. There's a couple brochures that are loaded here for Transamerica, so we'll just kind of click through it. And it brings you to Universal Life for Transamerica. Transamerica, so we have to answer tobacco question again. I'm not using tobacco. Are you actively at work on a full-time basis? And when you say yes to that, the different options pop up for benefit amounts and premium amounts. So we choose the level we like. We can add a child level term rider, $10,000, or opt out of it. We're choosing a beneficiary. And then going through. For the sake of time, I'm going to have to just not go into spouse and children because we have 8 minutes left. Do I want to receive electronic correspondence about my policies? Do I want to protect against unintended lapse? That means that somebody else is going to be notified if I don't pay my premiums. There's an option to do that or not. Are you currently disabled? No. In the past 6 months, have you been hospitalized or missed work for more than 5 days due to accident or sickness? And the AIDS question. Do you currently have universal life policy? Are you replacing anything? No. This question about illustration, we're saying that it was not given, so the answer is yes. Statement and agreement, yes, I agree. Understand. For the agent representative, yes, I certified all the information is correct. Releasing the forms, yes. Next. This is the term life, and you see this person is already has it maxed out. It's green, so no EOI needed. It was there before. We're adding a beneficiary. Same thing for spouse, 50,000 guaranteed issue. It's already green, so no EOI needed. If they're new coming in, it's going to be in red, and it's going to say EOI is needed. Short-term disability, again, if it's green, that means the person already had it. Long-term comes up, same thing. They're kind of sister package together. And then it's going through dental and vision. So they choose what level they would like to sign up for. Just one plan, really easy. Vision plan has a brochure loaded in here, so a couple pages of oh yeah, I know it's MetLife. So Christina, will you please take a note of that? We need to change that or let Chad know. Switch that. Should be MetLife.
Yes, ma'am.
Yeah, under vision, there's still Davis Vision brochure. All right, Chubb accident. Are you working at least 17.5 hours a week? Yes.
Elena, you can skip the voluntary. That's not.
Yeah, we have 5 minutes.
Yeah. One thing I wanted to touch on now. So we created sign-up sheets, and Claudette sent that out to all the locations. Claudette, should the enroller, when we make contact, or when we show up to the location, should we just ask for that? Or do you have those now?
I plan on sending you at least the 13th to the 17th. I plan on emailing you the sign-up sheets, if that's okay.
Yeah, that's totally fine. And then we'll distribute to the enrollers.
Okay. And I think what I'll do is I'll tell your enroller, I'll send you who they need to ask for when they get to the store.
That would be great.
Okay, perfect. Yeah, and so when you're calling your contact, either today or tomorrow, make sure you do that. Or Monday, just go over those things. Where should I park? what door should I go in? If they have the Wi-Fi password with them, I mean, you might not get it then before you show up. Just those details, just to make sure we're all on the same page. But they've all been informed. They're, I think in most cases, they're the ones that actually completed the sign-up sheet for the employees. So it has been well announced that they are coming. So everyone's expecting you.
Right. And when we sent out the enrollment sheets, the list, we sent it to the receptionist. So when your enrollers call, they can speak to the receptionist, and hopefully the receptionist can answer all their questions.
Oh, great.
Okay.
Mm-hmm.
Now, Alina, you're here in reserve. So my plan is I'm going to meet you here at whatever time you plan on being here on Monday. I'm going to meet you here, and the rest of the day you need to go.
Oh, wonderful. Okay. Yeah, that sounds good. Very good. Well, thank you so much for you guys. I guess if we have any other questions, we can just follow up via email. Counselors, did you have any questions? Everybody's good?
Alina, this is Julie. I have one question.
Scott, on all the booklets that you sent me, I'm supposed to send enough for each person at the store to have a booklet. Is that correct?
Yes, that's right. What we like to do is go over those brochures, give the employees something to walk away with. So, yeah, enough for each employee.
Okay. Now,
Julie, you had a question? I'm sorry. Go ahead, Claudette.
Do you want Britt and I to print one or two benefit guides and put that in the packet we're going to send? That way your people will have a benefit guide to go through if they have any questions?
That would be fantastic.
Okay. All right. We'll put that in the packet. And, of course,
Great.
I'll put my phone number and Britt's phone number, or we'll put a card in there. That way, if your enrollers have any questions when they're doing the benefits, they can call us.
Okay, perfect. And, we'll be standing by Monday morning nice and early in case anybody has any challenges. You guys can just call me directly, of course, and we'll work through Robin and Claudette to get whatever it is resolved. Julie, what was your question?
We have like 30 seconds. 30 seconds before the meeting is going to end.
Okay, I just had a quick question on the guaranteed issue. Is there a 1-year pre-ex on that? Because most of them have that. So I just wanted to make sure I give that to the client,
Can we follow up on that on TI?
Yeah, let's follow up because there's several products, worksite products. We'll follow up via email on that.
Mm-hmm.
Okay, thanks, Scott. And I'm sorry I was a little bit late getting on, but I got on.
No problem, Julie. Thank you.
No problem, Julie.
All right, thanks.
All right. Well, thank you so much, you guys. We're looking forward to meeting everybody. Yes.
Thanks, everybody. Have a good day.
Have a great day.
Thank you. Bye.
Bye.